All right, everybody, welcome back to the Really Cool Humans Network. I'm Dr. Casey Oliver, and we're again down here in the Neuro Clinic. And today, I want to talk to you about the Rebuilder. This is a really fun piece of equipment that we've been using in our office. And I'll tell you personally why we decided to use it. In concert, there are protocols, like we've discussed in the episode where we were talking about the cold laser therapy. There are protocols with the cold laser that we use for disc injuries, for example. A disc injury is what we would classify as a space-occupying lesion that might cause a little impingement on a peripheral nerve that would cause burning sensation, like burning pain, numbness, or tingling. Classic examples of sciatica. Who here has heard of sciatica? Most of us have. Burning, numbness, pain, tingling that goes all the way down into the foot. Okay, so there's specific protocols that we've used in the past with the laser for sciatica and for disc tissue repair and things like that. I personally didn't even know that I had a form of a neuropathy until I was introduced to this piece of equipment by our colleague, Dr. Jason Smith. He practices just a little further up north from us in Bountiful, Utah, and we were attending a seminar that we were live streaming online. And I was sitting there, and he was talking to us about how he was using this in his clinic and the benefits that he's seen from using the Rebuilder. And so he said, "Let me test you." So I said, "Okay." And he said, "Take off your socks and your shoes." So I removed my socks and shoes, and he goes through with the pinwheel and did a couple other sensory tests to just see if there was something going on with my feet. I had no idea, but the whole outside portion of my right foot had diminished sensation compared to the other parts of my body. Both lower legs and my left foot compared to the right foot. And so he said, "Let's try this. For half an hour, I want you to put your feet in the bath, and we're going to run the Rebuilder protocol and see if we can get some sensation back." It took one visit. We were just all there together. In one session, after half an hour, he retested, and my sensation was back. So I said, "We got to get this. This is really cool." So let me show you this piece of equipment that we have here. We use this mainly in two ways. Okay, you can see we've got a bunch of different things here in the tub. I'll remove these things out of the tub here and just set them right here on my table. Okay, this is the most important part of this piece of equipment is the tub, which we actually use. Okay, and this is the actual piece of equipment. Okay, so the company is called Rebuilder Inc. or Rebuilder Incorporated. Okay, and this is where we ordered this piece of equipment from. Let me just explain a little bit about how this works. Okay, usually it's kind of a complicated explanation of how it actually works, and so for the patients that we actually have that come into our clinic, I will actually hand them a 2-page printout off of the website, and if you want to access their website, just go on, you can search Rebuilder Incorporated and look at their homepage there, and they have an explanation of how this works. Basically put, what this does is it sends out a transmission, it sends out a signal. And if you can think of an echo, for example, anyone that's been in a canyon or yelled in an empty alleyway and heard an echo, this is how this electric, in a way it's a form of electric muscle stimulation or electric stimulation. It sends out a signal and it waits to get the signal back. Or in another example, it's kind of like if you've ever had your reflexes tested and the doctors come in and tapped your patellar tendon and your leg shoots out, okay, that signal fires up to the spinal cord, and then it fires back down to the tendon and allows that muscle to move and to fire, and that's how we test reflexes. So in essence, this is how this piece of equipment works. So when we initially put someone in here, this can actually tell if you're a 125-pound woman or if you're a 350-pound man, because it's reading the way that your body's responding to this electric muscle stimulation. So this is how we use it. Let's first talk about a couple conditions that we might use this for. Have you met anyone with diabetes? Okay, sometimes it gets severe enough to a point where they might develop a stocking glove pattern of diabetic polyneuropathy or numbness and tingling in the feet that may even spread into the hands. Okay, if you know someone like that, these are the type of patients that we use this piece of equipment on. So what we do is we fill this tub up, make sure it's nice warm water, not too hot, not too cold. We can always ask the patient as we're putting their feet or their hands into the tub how the water temperature is, and we can adjust accordingly. We use this electrolyte solution, and we'll put it into the water that we filled this bath up with, just to make the conductivity more effective of the electrodes here. So what we do, I'll show you with my hands. If I were to put my hands in here after filling up the bath, I'm going to place my hands in, dropping one electrode in each side. Now what we do is we just want to bring this up to what the patient can perceive. That just means tell me when you can feel it. So we turn this on and you can see the unit's working, and we start to increase the level, and it will reach a point where the patient will describe feeling a sensation. It's kind of like if you've ever, as a kid, maybe been around a cattle fence, you go up and touch the cattle fence, you feel that electric sensation. That's what it feels like. And oftentimes we'll see that the patient might have muscles up in their arm that might twitch a little bit, and that's okay. We just want to bring this up to what the patient can perceive. So whether you're using the hands or the feet, this is one way that we can use this piece of equipment. And then the process is really simple. You sit here for about 15 to 20 to 30 minutes, depending really how long we want to treat you for using the Rebuilder protocols, and you just relax. Get a book. Unless your hands are in here, you can't hold a book, but get something that you can occupy your time with. You can nap if you want to, but whether you're using the hands or the feet, we're probably going to run this a minimum of 15 minutes, maximum 30 to 45 minutes. And this is a fantastic piece of equipment that we've been using. I'll show you here. There's another way to do it. Oftentimes people will have a hard time getting their hands into this bucket and feeling comfortable, especially when it's full of water. It weighs a couple of pounds. And so what we can do is use this conductive lotion, okay, which you can put on both hands. The directions here, just apply right to the skin so we can squirt that on. You apply the lotion generously on both sides. And then the other cool part about this is it comes with gloves. These are conductive gloves that we use, okay? So as you're preparing to use this piece of equipment, you can just slip your hands right in here. And as you can see, you have a couple leads that run right into the glove. So we're able to actually remove, if I were to remove one of these electrodes here, and I can show you, we just plug this right into the piece of equipment here and turn it on. Now we just instruct the patient, if we're using the glove method, we don't want to cross the leads, okay? So you don't touch your hands together. You can keep them far apart like this, okay? And you just sit and relax and let the piece of equipment do its work. So the main goal, again, just to retouch on what we're using this for, is neuropathies or radiculopathies. You feel a radiating numbness, pain, tingling that might be caused, for example, by a disc herniation in your cervical spine, a disc herniation or bulge in your lumbar spine. We can treat the symptoms that you feel by using this piece of equipment, and it's worked phenomenally well. So again, just to introduce this great company again, this is Rebuilder Incorporated. I'm thinking of a couple case studies that we've done, a couple cases that we've actually used this equipment. One of which I can think of was a personal injury case. Actually a really good friend of mine that came in. She had been in a nasty car accident. She works for a living as a housekeeper, and so she's in and out on her hands and knees, scrubbing bathrooms, toilets, mopping floors, cleaning all these beautiful homes around here. And she was having a hard time feeling sensation in her hands. So she would go and come in here and complain to me about this numbness and tingling, and even to the point where she didn't really know where her hand was because she couldn't feel anything. Similar conditions, if you can think about people that you may know that have had carpal tunnel syndrome, for example, or ulnar nerve neuropathies. Okay, you hit your funny bone, okay, and then all of a sudden you lose some sensation, or you're feeling some weird feelings here in these two fingers. Similar condition that also affects these two fingers most of the time, thoracic outlet syndrome. Okay, I can't tell you how many patients we've put on maybe even one session to 2 or 3 sessions that just rave about how well this works, how it helps them get feeling back into their hands, their feet, how it gets rid of the pain that they've been dealing with oftentimes for years. And there's actually a handful of patients that love this piece of equipment so much that they've just asked if they can have one themselves. So we make the order, we call the company, they give us the equipment, and then we pass it along to the patient with very specific instructions to make sure that everything's being operated safely in the home. So we love it, and we're glad you tuned in again to learn a little bit more about what we can do to help you and all these different health conditions that you may be dealing with or people that you know may be dealing with. Thanks for joining us again. I'm Dr. Casey Oliver with the NeuroClinic. Check out our website at theneuroclinic.org or give us a call anytime, area code 801-766-6580. We'll see you next week.